Let's dive into Alzheimer's disease, or AD, a neurodegenerative condition that progressively impacts cognition, behavior, and daily functioning. Now, when it comes to diagnosing AD, biomarkers are absolute game changers. Today we'll spotlight some of the most studied and impactful ones. Amyloid V, AB. Let's kick things off with amyloid V, one of the hallmark markers of AD. In the brains of people with Alzheimer's, amyloid V forms abnormal deposits, those infamous amyloid plaques. Among its forms, the AV42/AV40 ratio has proven to be a highly reliable indicator of brain amyloid deposition. Tau protein, next up tau. This structural protein helps stabilize axons in neurons. But in AD, tau goes rogue, aggregating into neurofibrillary tangles and wreaking havoc on neuron function. Biomarkers like p-tau217 emerging as a particularly promising star in the diagnosis of AD. Neurofilament light, NFL. Neurofilament light, or NFL, is a structural subunit within neurons. It plays a vital role in maintaining their stability and supporting axonal growth. Neuron-specific enolase, NSE. Neuron-specific enolase, NSE, is an enzyme closely tied to glycolysis in neurons. When neurons face acute or prolonged damage, NSE levels in cerebrospinal fluid shift, making it a strong marker for neurodegeneration. TNF-A. Now for a key player in inflammation, tumor necrosis factor alpha, or TNF-A. Produced by microglia, neurons, and astrocytes, this protein orchestrates chronic inflammation in the brain. It also influences amyloid plaque synthesis and neurofibrillary tangle formation, making it an intriguing target for curbing AD progression. BACE1. Finally, we can't talk about AD without mentioning BACE1, or V-site amyloid precursor protein cleaving enzyme. This enzyme is like the ignition key for producing AB peptides, the main culprits in AD's early pathogenesis. Elevated BACE1 activity is a red flag in AD, which is why researchers are actively exploring BACE1 inhibitors as potential therapeutic options. In summary, biomarkers like these aren't just scientific buzzwords, they're the keys to unlocking earlier and more accurate AD diagnoses. Ready to learn more about the fight against AD? Stick around!